Higher order brain functions include learning, memory, and reasoning. So these occur within the cerebral cortex and involve multiple areas of the brain and also conscious and subconscious processing. An electroencephalogram, or EEG, is a diagnostic test where you place electrodes on the head and record electrical activity from brain activity. Okay, so this can be used to investigate sleep disorders or brain lesions, also to determine if your patient is in a coma or a persistent vegetative state. We can also use EEGs to evaluate a seizure. Seizure is just an abnormal firing of the neurons in the brain, so abnormal electrical activity, and there are different types. An absence or absence, as I've heard it called, seizure, is a non-motor sort of general seizure. With these, you may have a momentary loss of consciousness, or your person may be just staring into space with or without twitching like we commonly think about with seizures. A tonic-clonic seizure is the most common type of just a generalized seizure where patients can pass out, have body stiffness, and or shaking. So an EEG produces and measures 4 different types of brain waves: alpha, beta, theta, and delta. The distribution and frequency of these is going to vary depending on whether it's a child or an adult, if they're having a seizure, if they're asleep, or if there is a pathologic state of consciousness. For example, alpha and beta waves are usually seen in an awake, alert state, but your thetas and your deltas are more common during sleep. So if an adult has an abnormal presence of theta and betas when they're awake, that suggests there may be a brain abnormality. And this slide just gives you a representation of those waves. So you can see in an adult, beta waves indicate awake with mental activity, alpha, awake but resting, theta, I'm chilling, I'm asleep, and then your deltas during a deep sleep. We normally alternate between alert and sleep. Now, sleep is just a temporary, natural absence of consciousness. And, of course, because we are just asleep, we're not in a coma, we can be roused, we can be awakened with normal stimulation. During sleep, our cerebral cortex activity decreases, and the function of the brain stem, though, with our vital centers that keep our heart beating and keep us breathing, those don't take a break when we sleep. They continue to function. So sleep is a natural, repeated condition for rest of both your body and brain. During that time, we have decreased body activity so that we can conserve energy, increase growth, and basically just renew and refresh. We have 2 categories of sleep: REM, which is rapid eye movement, and non-REM, which is non-rapid eye movement, and both of these are characterized by their EEG patterns and the presence or absence of eye movement. During REM sleep, okay, so you see this right over here in the purple, it's very similar to active brain waves. So here's active brain, we're awake, here's your REM sleep. So we have an increase in body temperature, heart rate, respiration, and blood pressure. But we decrease activity in the gastrointestinal tract because we don't want to have to wake up in the middle of the night to poop, right? So we use more oxygen than when we're awake. The eyes move very rapidly, hence the name, rapid eye movement. But our skeletal muscles are mostly limp. So we have sleep patterns that alternate between REM and non-REM, with non-REM taking up about 90 minutes and REM sleep about 10 minutes throughout a 100-minute sleep pattern. Now, your REM length increases if you stay asleep longer. The amount of sleep a person needs varies as we age. So infants usually sleep about 17 to 18 hours a day. Wow, can you imagine? I'd be rested, but I probably wouldn't get a heck of a lot done. Teenagers, well, they sleep about 8.5 or need about 8.5 to 9.5 hours of sleep, and the average adult drop it down to about 7 to 8. Man, I'll tell you, I have insomnia. I'd be happy to get any of those hours. Now let's think about what these two different types of sleep are responsible for. It's thought that non-REM sleep is our restorative sleep, where the body rests and repairs. Whereas our REM sleep, that's where we have most of our dreams, even though we may not remember them when we wake up. So we spend about 75% of our time, as we saw on the previous slide, in the non-REM. So the REM sleep is more for consolidating and organizing memories, because our brain's very active during this period, and we use a lot of oxygen, just like when we're awake. So this gives the brain an opportunity to analyze the day's events, to work through emotional events or problems, and eliminate unneeded synapses that were formed that we really just didn't need. So if we're deprived of our REM sleep, we become moody and depressed. Now, interestingly, alcohol and sleep medications can suppress your REM sleep, but not your non-REM. So we still get to rest and restore. We just don't process the events of the day. Let's take a quick look at some homeostatic imbalances related to sleep. So insomnia refers to the difficulty in falling asleep and or staying asleep. It becomes much more frequent as we age, and certain medications can interfere with sleep, including how frequently we experience that REM sleep. So sleep apnea is characterized by stopping breathing during sleep, and then we wake up because we have that hypoxic or low oxygen state. Narcolepsy is when we fall asleep when we're not supposed to. So driving down the road, you fall asleep. Yeah, there's a problem there, right? So you temporarily fall asleep. Cataplexy is when you have a sudden loss of voluntary muscle control that can happen with narcolepsy. And the autoimmune system, or your immune system, can destroy orexins, which are chemicals that tell your hypothalamus to wake up and keep you alert. All right, let's continue on this topic and look at memory. So we classify memory in various ways. For example, sensory memory occurs when we form associations based on sensory input from the environment, like the sounds when you enter a cafeteria, the smell of the food, the bright lights in the room, how the tables are arranged. So sensory memory tends to last only for a few milliseconds to a second at most. Short-term memory has a limited capacity to about 7 segments of information. That's not a lot. That's basically a phone number. And it has a brief duration. We remember these things for about a minute unless we repeat them or rehearse that memory. For instance, if I told you my office phone number is 850-484-1171, you could remember that for a few seconds, maybe a few hours. But if you didn't sit there and say it over and over, or write it over and over and get that repetition or rehearsing, then you would probably forget it by tomorrow. So if you want to remember my office phone number, 850-484-1171, 850-484-1171, 850-484-1171. You might remember it now, but you'd remember it better if you did that and you say it to yourself over and over, or you write it over and over. But then what are you doing? You're taking that short-term memory and turning it into a long-term memory that may last for the rest of your life. But it can be lost if we don't pull that file back up. So I think of long-term memory like archiving the files on your computer. You have a short-term memory when it's still on your computer screen, right? But then if we save it and put it away, we're going to forget about it and forget that it's archived if we don't bring it back up every now and then. So that's the difference in long-term and short-term. Now, long-term memory does have, as they say, sort of an unlimited capacity. Now, if you remember your ABCs, how do you remember them and why? Well, you remember them because you practiced, you rehearsed, you repeated it over and over and over, and then it got encoded from short term to long term. And because we use our ABCs to make words all the time, then you're not going to forget it because that information is being constantly retrieved. Now, it may not be that we're singing the little song, A, B, C, D, E, F, G, but we're using that information in a different manner. So long-term memory, as long as we refresh it every now and then those memories will last us throughout a lifespan. So think about your mother's face. You know exactly what she looks at because you've seen it over and over and over. Again, guys, that's repetition. You know what the color blue is because you were taught it. You had a short-term memory of blues and greens and reds and purples and yellows and all of that. But you remember those not because you learned them once, but because you are continuously using those. So if you have someone that has difficulty remembering things, maybe try to put it into a song. One of my daughters, sometimes she has difficulty remembering things, and when we moved once, I taught her her address to music. And so to this day, you can ask any of us where we lived in Fairhope, and we will all say, 105 Ashley Drive, Fairhope, Alabama. Guys, I haven't lived there since, oh gosh, the year 2000. 24 years, and I still remember that. Not because that address was important to me, but because I rehearsed it and it became long-term memory. There are several things that affect the way we transfer short-term memory to long-term memory, and one is emotional state. You learn best during times of stress because you remember the situation in which you learned it. For instance, have you ever had a car accident? I bet you remember who was driving. If you were old enough, you probably remember where you were. If you were in your car or someone you're familiar with, you probably, even if you weren't really familiar with that person, you probably remember what the car looked like. So that was an emotional state. You had a car accident. You were scared. But I bet you also remember things from when you were happy. Think about when you won an award, or when someone proposed to you, or the first time you were kissed. Okay? You learn during times of high emotion. Rehearsal is what I was just talking about. Repeat, repeat, repeat. Now, think about when you learned your ABCs again. What did you do? You heard it over and over, and you sang the song over and over. How did you learn your spelling words when you were a child? Oh, that mean old elementary school teacher made you write your words 10 times each and use it in a sentence. And then if you missed it on the Wednesday spelling test, you had to write it 25 times each. And then guess what? When you took the second test on Friday, you didn't miss that word, did you? No, of course you didn't, because you rehearsed it. You practiced. Repetition helps you learn. I'm always telling my students, repeat, repeat, repeat. Listen to my videos. Listen to them again. Take notes when you're watching. Take notes the second time you watch. Not reading the same notes. Write it again. Listen to the sound of my voice on the videos when you're in the bathtub, when you're driving to school, when you're cooking. Now, you don't want to look at the PowerPoints, but you can listen. That still counts as repetition. Write your notes over. Type them out in your computer. Save them as a Word document. Go back in and try to fill things in after you delete some of it. So the more times you engage with the content, the more likely you are to associate or to be able to pull that back up and get it sunk into your long-term memory so you don't forget it. Another clue for making sure that you can retrieve those long-term memories and they don't stay short-term and get thrown out is association. Tie it to something that you already know. For instance, when I'm teaching antidiuretic hormone and how it causes us to save water by getting it out of our little tubular filters. Well, I talk about a leaky water hose, and if you poke holes in the water hose, what happens? The water leaks out. Well, that's exactly what your kidney filters do in the presence of a certain hormone. If I told you that I have decided to take up crocheting, well, if you've never heard of crocheting, I could say, well, it's sort of like knitting, and you know what knitting is, then you understand more about what crocheting is, and you would remember it. So if you tie new information to old information you already have stored, then it transfers easily to short-term memory, and you can pull it back up as you need it. But then we have that automatic memory. This ties back with that emotional state when I think about it, because a lot of times automatic memories are formed when we're not really trying to form a memory. Again, if you have a car accident, you remember the accident, but you also remember the color of the car. The color of the car didn't have a darn thing to do with that, but you remember it. Not that you tried, but you subconsciously remember the color of that car. Let's say you went to your prom and you saw someone in a beautiful dress, and you remember how they looked and how that dress fit. And it's not that you really wanted to remember that dress, but you remember things about that dress and the girl that had the dress on. And it's not that you were trying to remember it, but it impressed upon you how pretty it was and how well she wore it. So automatic memory are those things that we just remember without trying to remember. Again, it could be when you fell off your bicycle and broke your leg. Well, you weren't trying to remember that, but I bet you know what color your bicycle was, and I bet you know what caused you to have that bicycle wreck. So that is automatic memory. So try some of these strategies, guys. They will help you to remember things. And I'm sorry if you saw that mouse running all over everywhere. I couldn't get it positioned on my screen right. But these will help you to move things from your short-term memory to your long-term memory. We can further classify long-term memory into two categories. So fact memory is what we call explicit memory. You remember names, dates, words, events. So it's filled with the context where you learned them. If you learned about how to drive a car, well, I'm sorry, let's forget that one. That's going to get a little bit more into the implicit. Let's say you learned your address. Well, when did you learn it? Who taught it to you? Why did you learn it? If you remember an event, you remember it because something important happened. You went with somebody important. You probably remember the date and what you had on. So that is factual memory. Your skill memory is your implicit or non-explicit memory. So it's less conscious, but involves a whole lot more motor activity. I bet you could explain to someone how to ride a bike. Why? Because you know how to do it, because you have the memory of how to do it. But do you have to think about those steps in order to ride your bike? Move the kickstand up. Put your feet on the pedal. Put your hands on the handlebar. Put your other foot on the other pedal. Start pressing down, and those pedals will cause the bicycle to move. What do you do if you want to stop? Put on the brakes. What do you do if you want to turn left? You turn the handlebars to the left. But do you have to think about all that to do it? No, you don't. If you play piano, you can sit down and automatically just start, playing that music. Do you have to really think about it? No. You know how to move your hands on the keys to perform that skill. So this is sometimes called skill memory because you remember how to do things that you don't necessarily have to think about in order to do it. Amnesia is a condition where you have partial or complete loss of memory. Now, this usually is temporary and only affects a part of your memory. There's things that can cause amnesia, and it ranges from psychological trauma to a brain injury like a blow to the head or even a cerebrovascular accident. Now, because processing and storage involves a lot of brain areas, The type of memory loss that occurs can depend on the particular area of the brain that is damaged. The most serious forms result from damage to the thalamus and the limbic system, especially the hippocampus. There are two major classifications of amnesia: anterograde amnesia. Antero, think forward. So no new memories can be stored in the brain. So you live in the moment because you don't remember anything new to store as a memory. Retrograde amnesia is when you lose the memories that you have already formed, but you can make new memories. So retro means behind. You lose the memories of the past, but you can make new memories. Anterograde, you can't make new memories, but you do remember the past. Alzheimer's disease is the leading cause of dementia in the developed world, and it is sometimes known as the long goodbye because it is a very slow, progressive loss of your intellectual function. So you start to lose that person long before their actual death. Now, this is a type of dementia, which is just a general loss of cognitive abilities, which can include memory, language, and decision-making skills. It usually starts over the age of 65 and becomes more apparent in the 70s, unless it is early onset Alzheimer's, and that is when the symptoms develop before the age of 65. Very often it's hard to diagnose because confusion with other types of cognitive impairment. So the symptoms include, again, that very slow progressive loss of your intellectual functions and changes in mood and behavior. It gradually causes deterioration of language skills, impaired visualospatial skills, different attitude, poor judgment, but all your motor functions work pretty well. You can get up, move around, you're just not processing your thinking properly. So patients tend to become confused and restless, and they typically will ask the same question over and over. Now, there are multiple causes, but it really does remain a mystery because it's both genetic and environment that play a role in this. There are also autoimmune versions where the immune system attacks cells. The significance of the beta amyloid plaques and the tau tangles that accumulate in the brain is debated. The reason that's currently debatable is because nobody's sure if it is the cause or if it is caused by the disease. Now, there is no cure, but there are medications that will help to slow the progression. Until recent years, the only way to diagnose Alzheimer's disease was to perform an autopsy. That means the person is dead. Now, we do have PET scans, so that's positron emission tomography. So these scans appear to be able to identify the brain changes early that we see with Alzheimer's, and therefore treatment can begin much earlier as well.